Hi, I'm Susie Moss, and today, with all your help from our first video, we're going to continue and do a second video. And I appreciate all the views. We reached 127 views on that video, and my goal was 100, so thank you for doing that. It just motivated me to come back and do the second part, and then of course, I promise you guys a third part. Now, today is going to be billing and coding and working and doing that in the doctor's office. Now, it's always hard to explain to somebody what biller and coders do. And, I rack my head and say, like, okay, how do I explain this in the most simplest ways? Then it hit me, okay? So what you need to do right now is close your eyes. Now, visualize that time when you went to the emergency room. And then the first person that saw you took all your demographics, took your insurance card, and you're sick and you feel horrible and you're so upset because they did that first. And you're like, I can't believe it's all about money and I just need to get seen. Well, it's because they're doing a bigger part to help with the billing. So then you go in and go to a triage room, and then the nurse takes your vitals and asks what's wrong with you. And they do all these testing, and then now they decide, okay, so which room are we gonna put you in? So then they put you in the room that you need to be in. Then the doctor walks in, or the PA walks in, and they examine you. And after speaking to you, they realize all the different tests that they're going to do, and they order them. They draw your blood, you're there for hours, and then guess what? They find out, oh, you have gallstones. And now they tell you you need surgery. But they're not gonna go ahead and do that right now. We're gonna go ahead and refer you somewhere else, and that can get done a different time, but we're just gonna go ahead and treat you for that pain. Now, open your eyes after you visualize that and count in your hands all that interaction you had with the front person taking your insurance card, giving the demographics, the exam when they drew your blood, the exam itself, all the different tests have a code to it. So all that happened that day created all these different codes, and guess what? That starts coding. Now, I'm not saying coding is for everyone. I mean, it does take a special person. This person has to be a critical thinker. Someone that likes to read, investigate, and see what really happened with this patient. Why did they do these tests? Why did they order the blood test? And they put that all together using codes, all right? One book that we use in the office or any facility that you work at is going to be your CPT book, okay? Now this looks long and boring, but it's not. All these codes have money value to it. When you closed your eyes and you saw all those things that you're visualizing, this is what we're trying to visualize, what you are seeing, and then we're gonna put it in to all these different codes, okay? So then the doctor decides to tell you what's wrong with you. I told you had gallstones. Well, then we use the second book, which is called ICD-10, and this gives you all the different things that the doctor could possibly find with you. Now, we don't always go to the doctor because something's wrong with us. Sometimes we go in, and because we are pushing, right, to be better and better health. This year is my year to get in shape, but before I start any type of exercise, I need to go to see a doctor and get a physical. And guess what? Do some more procedures. But we also have codes that can justify that. So once again, close your eyes and see that every visit that you went to, office, clinic, all that, us coders, we interpret that into different codes. Now, how do we do that? Well, this is what you call a claim form. This is called a CMS 1500 form. Now with this, for every coding assignment you did on one patient, it creates this form. So now close your eyes again and see how many beds you think a hospital has. Each hospital has about 200 beds. Now imagine everything that's being done on that person all day, every day. And guess what? One of these gets created all day, every day. So we're talking about 100, maybe thousands of claims per, I didn't like that. You're not edit that. Now visualize all the different amounts of claims you created. Okay, so this took a special person. This took your biller and coder because they understood how to interpret your story that you visualized and made it into codes. Now, like I said before, that takes a critical thinker because they are able to, with this claim form, put that whole story into this with just numbers and letters and send it off to insurance companies so you can get paid. Now, that's me talking to you as an instructor. I'm also here because in the first video I told you that I am an office manager, and in my office I do have biller and coders who do this for me. What they do is they interpret Dr. Blumenfield's progress notes and make them into codes. Now, like I said, they had to be good critical thinkers because not only are they looking to see what happened, but then they also have to learn medications. What is the patient taking? Did Dr. Blumenfield forget to document that? Because nowadays, if it's not documented, you know, we always hear that term, it's not documented, it didn't happen. But guess what? If it's not documented, it didn't happen. Now it becomes an audit and they give you a report card. Times have changed in the medical field for billing and coding. This is why we're in demand to be certified and come to school, because it's just not about the claim form, it's about the auditing involved and getting that report card for everyone to see. Okay, so now every year, different insurance companies will grade us and they'll tell us how we rank nationally. And I'm happy to say that we just got our latest one at Dr. Blumenfield through Humana, and we ranked one of the top coding facilities for ophthalmology. And that says a lot about my office. And mainly because guess what? 2 of my certified coders are from SU. They came here to this school. They were students and I took them as externs. We taught them all the back end that they had to know in the office. They learned all the fundamentals here at school, interpreting what you visualized at your office into numbers and codes. And they mastered that and they passed the certification called CPC, Certified Professional Coder, through the AAPC. So these 2 individuals are very dear to me, very special to me. Don't worry, they don't get special treatment. I treat them just like every other student or employee, but this they do hold because, you know, I got to see them from them barely learning what a code is all the way to not actually coding and helping my office bring revenue. Now I'm going to bring back this claim form because their job, just even as simple as getting the demographics, the diagnosis, the procedures equals my revenue. Okay? Now, we all need money. We want to pay the bills. We want to get new machines. We want health insurance. We need all that. I depend a lot on my biller and coders to do their jobs correct so we can get the ultimate payment for that procedure, because sometimes if we don't do things like that right, we can lose out money and it's not going to be good for the practice. And as an office manager, I can see the trends. I could look how many claims were sent out. I can see all the errors, and then we go from there to improve it. Now, today I'm not going to just talk about me. I actually brought someone with me. I brought Adrian Gristoval, who's actually a morning student here, and he came into me knowing him. Actually, he doesn't know this, but his mom had talked about him to me maybe 6 or maybe in a year before that, and I never knew that our paths were going to cross. And she had told me she had a son that was thinking of coming back to school, and I never really remembered that until after he actually started with us. Well, Adrian's been really dear to me because Adrian's a go-getter. He's always asking questions. He's always saying, yes, ma'am. And he just does everything in his power to make sure he masters billing and coding. And not only that, he also does surgeries. He schedules them. He does front office. Anything that I ask him to do, he's being cross-trained to do. And the reason I brought him, not only because he's my employee, but he also came here and wants to give his testimony on the both sides, just like I did, being an instructor and then, also being a health administrator. I also wanted to mention, because I'm not sure if I'll come back after Adrian speaks, one thing I do gotta tell you that here at Southwest University, the billing and coding instructors and health admin instructors have a lot of heart. I'm sure, SU doesn't know this, but we actually have a chapter here in El Paso through the AAPC. This is a national certification, and we have a local chapter here. And we are so blessed that the school allows us to meet here once a month. And we have over 700 members all across El Paso. Not all 700 come, obviously, but a good percentage come to this school. And then we meet once the first Saturday of every month, and we go over coding. We have guest speakers. We just had Ms. Rincon, who was our first guest speaker for January. And you know what? She rocked it. I've never had so many good emails saying like, wow, continue your meetings to be that informative. I didn't fall asleep. That Ms. Rincon has so much passion. And then I started thinking right there and then, I was all like, that's why she's an instructor here at Southwest University. Then you also have Cecile Avila, who also teaches billing and coding and has been an officer in the past, to give back to El Paso. So we don't just leave our students, once they graduate. We continue because the school buys them their first year membership, and then once they get certified, they stay members because then they get their CEUs, and we don't lose that relationship because then we see them at the meetings. And here we are. Even Erica Cardosa, our director, always makes our meetings. If there's any job openings, for the school or anything like that, she'll bring it up there at the meetings, and we just do all sorts of networking. And I can guarantee you probably most of you don't know that we do that. And you are always welcome to, as I'm actually the vice president this year, so as long as I'm in an officer, anybody's welcome to come join us. You guys can see, all the involvement that happens as coders. There's a lot of passion. There's job leads, and students just get so motivated when they come to these meetings. And it's worth it to wake up on a Saturday morning. And even for the young ladies that work here who had to come open the doors for us and then stay and work and then close the doors for us like 4 hours later, thank you so much for that. But billing and coding needs to grow. It needs to grow in El Paso. I mean, we only have 700 members. When you think about it, there's probably thousands of coders in this region. So I'm going to go ahead and let Adrian speak to you. Like I said, Adrian is one of my biller and coders, SU alumni. Adrian.
All right. Hi, good morning. My name is Adrian San Cristoba. I just want to start off by saying thank you to Susie for the kind words. And I also want to give another big thanks to SU. Without them, this past year, I don't think I could have honestly imagined it playing out how it did. Because of SU, I have built relationships, I have gained knowledge, I have learned skills that I don't think I would ever been able to do or utilize in any field at all. Because without SU, I truly think that I wouldn't have been motivated to do what I'm doing right now. SU brings a set of goals for students that actually makes them want to learn, that makes them want to take the next step in life and actually reach their goals towards their career. For me, SU has brought so many opportunities with meeting new people, with, first of all, my teachers, those new people, they taught me things and showed me, showed me skills that I've honed now that I think I'm getting quite good at. So without them, first of all, I know for a fact I wouldn't have learned the way I learned and I wouldn't be where I'm at right now. So a big thanks to them. Another person that I do want to give a big thanks to is Miss Tiffany, the person that is involved with the job placement. So I had a really bad experience at my first externship site. And bad experience as in with the site, as in I wasn't learning what I was going to school for. I wasn't being taught the way I needed to be taught by the staff there. And I brought it up to the attention of the staff of SU, and no more than a day they were already on it. They were helping me look for another site, and that's exactly how I was introduced to Miss Susie Moss. And one of the best decisions of my life was to bring that up to my my director and the person that was helping me with externship. Like I said, it got me to meet Susie Moss. It made me meet Dr. Blumenfield, and it gave me the opportunity to get a career and start my career, you know? So it is a really big thanks to them. And because of SU and the way I was taught, I take that into the field now, and because I was taught well and I was managed to, you know, use my CPT books and use my ICD-10 books the way I need to, the technical way, I feel like I'm doing a great job at Dr. B's office. And not a lot of people can honestly say that about any institution they go to, because, for instance, I have some friends that have gone to other places, and there's a big difference, and I don't want to say educational levels, but there's a big difference on how we use our skills with the ICD-10, what we know about insurances, what we know about billing those insurances. And like I said, I think SU really takes the time to do what they need to as a facility to really teach us what we need to go on to the next level. And that's where a lot of people, I guess, stop. And I mean that in the way, like, so you go to school and they just teach you the book stuff and everything. But I like SU because they went far and beyond that, and they made sure that I was gonna get ready for the real world. The real world is what counts. So I think that was something that I need to be appreciated of. But yeah, like Susie was saying, we want to get paid for our job, and we want to, as a facility, we want to be able to buy new equipment. We want to be able to pay our employees. So that begins on the coding and billing. Obviously, if we don't code right, if we don't bill right, does the office get paid? They don't. So I think it starts with us in the office that we play a very important role, just like everybody else. But I do think the billers and coders, they have a special place in the office. Not only because obviously they deal with all the revenue and the codes, but in some instances, sometimes I actually teach Dr. Blumenfield something, or I correct him on something that he doesn't notice on his diagnosis or his procedures or something like that, or what goes hand in hand and what he can and can't do with certain insurances. So I like to think of myself as a source of knowledge as well there in the office. I know I might be young and not as experienced as the other workers, but because SU taught me the right way, I'm able to give my knowledge and my input with the other workers, and they accept it really good, and I do like that. I like that I'm able to come with the proper, I guess you can say the proper terms and the proper vocabulary that, you know what I mean, that SU teaches you, that the teachers make sure that you know before you go into the real world, and they appreciate that. You know, I'm not just saying this because it's out of pocket, or I'm not trying to correct somebody because it's just because I want to be right or anything. It's because I've learned the right way. I've read my books. I was taught the guidelines right. So that I am very appreciated for. And once again, just because I'm a biller and coder doesn't mean that that's the only thing I do. But because I have knowledge from that, I'm able to help with surgeries. I'm able to help people get verified to see if they can even have the surgery first. So it goes hand in hand, all in all. So I really do believe when you put in the effort, when you put in the time, you're gonna get to where you want to. And I think that's where I'm heading. So I do gotta say that I'm really grateful for SU. I'm really grateful for the staff. I'm really grateful that SU as a whole really cares about the students, and not just, oh, well, the more the students, the more the revenue. They actually take the time to do what they need to make sure that we hone these skills and we take them to the next level of life, and that's the real world. So yeah, I just really want to say thank you to them. And
Hi. Well, thank you for listening to Adrian. You know, like I said, he's been an inspiration, and don't get me wrong, he critiques me too, and I always ask him, you know, how can we improve? How can we make the classes better, more fun, more engaging? And I always get his feedback, as I do our other coder that came to SU. Now, a lot of, you know, it's still so hard to imagine biller and coders. You know, after I had you close your eyes and you visualize that, like, well, really, you know, where does that really put me at? So I actually made a list of all the possible places that a biller and coder can work. And I'm sure there's more out there. I just went based on the CPT book. We have a page where it says place of service. And I want you to know that there's endless. You don't have to just, I know for sure Adrian, maybe even a couple of years won't be with me because he's gonna go on and master everything he can with me and then move on to better and other opportunities. And you know what? I'll push him to do that because he is very intelligent. And I feel as health administrators, you know, we need to empower employees and we need to empower them even to leave us, not to stay stagnant. Now, I did write a list and you can work from home. Large facilities hire remote workers. The big one here in El Paso is TRICARE. I know also biller and coders that code for other facilities in other states. That's becoming a newer thing. You can work for insurance companies, United Healthcare, Superior Medicaid, Molina, El Paso First, Epic. Hospitals, Tenet, UMC, Beaumont, Las Palmas del Sol. Ambulatory facilities, El Paso Day Surgical Center of El Paso. In fact, I have a student that started here, maybe like 5 years ago. She started in a clinic, and now she's one of the supervisors at at Surgical Center of El Paso. Clinics, WellMed, specialty doctors, family practice, outpatient facilities, ambulance, nursing facilities, hospice, dentists, mobile units, diagnostic centers, urgent care centers, birthing centers, psychiatric facilities. A big one here in El Paso is Peak, who hires a lot of our students. Sleep centers, substance abuse treatment facilities, public health, medical and billing and coding companies, schools. I mean, there is so much endless opportunities for biller and coders. And even for you health administrators, at one point you did learn billing and coding or you have your certification, because that's what's needed. We all need to know how the money is created. How do we keep it? How do we grow it? How do we sometimes just get rid of testing that it's not really working for us? It's better to send them out and get the test done in the hospital instead of doing it in the office because we don't have enough volume. And that's real life practice, like Adrian was saying. And we learned this here at Southwest University, and we put it into play when we're actually working out there. So I hope you enjoyed our video. Next time we do come, it will be back office, and we'll have Arlene, who is actually also an SU alumni, who now is a tech for us, and she's doing a wonderful job. And that way you can get an insight. And if you guys ever have questions or need us to be guest speakers, we would be happy to come talk to your class and give our perspective and answer any questions they have, because SU does make you happen.